Guys, welcome to the Chief Life Podcast. I am Matthias Turner, and today I'm very excited. I've got Dr. Michael Platt with me. Dr. Michael, welcome.
Well, hi there. Howdy.
Thank you very much for joining us. So you're in California, and you've been... I'd actually love to dive into your background a little bit. We'll do that in a second after I introduce you a little bit more, because I know you've had quite some interesting things happen throughout the Californian region with the state of California, but I would love to actually dive into what you do and who you are a little bit more. So you run platwellness.com. Pretty much your whole deal is working with people, working with adrenals, working with hormones, and you've written 3 different books. Adrenal Dominance is one of them. The Miracle of Bioidentical Hormones is another, and then the last one is the Plat protocol for hormone balancing. So I'd really like to dive into all of the concepts around the books and the Plat protocol in general, but what I'd love to hear firstly from yourself, Dr. Michael, is a little bit about yourself. Like, what's your background? What got you into doing what you're doing?
Well, I was born and raised in New York City, and did all my training back east, and then I headed out to California. My mother died at the age of 61 of breast cancer, and it was right after that it sort of sparked my interest in hormones, because I realized right after she died that I had inherited her hormones. You know, most people don't realize that men and women had the identical hormones, different levels, but the same hormones. And I realized that she had breast cancer, which is caused by estrogen, because she had a lack of progesterone. And at the same time, you know, she had some extra weight on around the middle, and the only thing that puts on fat around the middle is insulin. So I was thinking that, well, maybe there's a connection between the problem with the low progesterone and too much insulin. And at the same time, when I was driving, I used to have to slap my face trying to keep my eyes open. And that is usually a low blood sugar, you know, again, caused by too much insulin. So in any event, I started using progesterone. And all of a sudden, I never got tired, you know, or sleepy driving anymore. And that's been true now for the last 30 some odd years. So that really sparked my interest in hormones. And I tried to learn as much as I could. And it occurred to me that, you know, every system in the body is controlled by hormones. And interestingly, you know, doctors are not trained in hormones. And I hate to say this, especially gynecologists. They have, what I have noted, the least knowledge of hormones of all doctors. And that's where women go to. So in any event, I started specializing in hormones. And you know, and my first book was actually The Miracle of Bioidentical Hormones. And if you ever do read my books, you'll notice that there are no references in my books, because everything I've learned from my patients. And I had the I guess the benefit of being able to sit down and talk to them for about 2 hours, and you know, and I was taught that the 90% of a diagnosis of a patient, just sit down and talk to them. Doctors don't do that. You know, they look at lab tests, they looking at their computer now, you know, but anyway. So and eventually what I noticed also is that, you know, one of the primary concerns for the whole medical system, because again, doctors are not trained to treat the cause of illness, that I noticed that there was a relationship between problems related to excess adrenal and problems that people had. And that opened up a whole new world to me. And the book that, you know, the other book that I wrote called Adrenal Dominance is actually the only book ever written that talks about the clinical consequences of too much adrenal. And we'll get into that, but I think people will be surprised to find that there's probably every family in Australia is probably affected by increased adrenaline. So that's basically it. You know, I've been board certified in internal medicine, and as you sort of alluded to, I got in a lot of trouble with the state board in California, not because I've hurt any patients. They had complaints from doctors, because when you treat the cause of illness, people don't need drugs anymore.
Yeah.
And even though prescription drugs are the third leading cause of death, at least in the United States it is, I got in trouble for taking people off drugs, even though I never harmed anybody.
So
but, you know, the medical boards are completely funded by drug companies. So they're, you know, I understand they're there to protect the drug companies. They're not there to protect consumers. So
it's really upsetting. A similar thing has actually just happened here in Australia to a doctor who he sent some patients' results over to, well, he sent some stuff over to Germany to get it further tested on, and they saw that as unfit practice, and it was going beyond the client's, I don't know what it came down to essentially, but it was saying, hey, you've gone too far and we're now going to take your license away because you're no longer using the Australian Guide to healthy lifestyle or whatever, or healthy medicine. So it's pretty ridiculous to see that that's the case, because really as a doctor you're there to help the individual, yet that's not actually what they're out for.
I understand.
Yeah, it's quite bizarre. So let's kind of dive into it a little bit. You said that the bioidentical hormones book was the first one, the miracle of bioidentical hormones. And what I'd love to really go back to, before you were talking about the connection between insulin and progesterone, how does that work?
Well, it's just that, you know, progesterone is generally thought of, first of all, most doctors and most people think of it as a woman's hormone.
Yes.
But as I mentioned, men and women have the identical hormones, different levels.
Yes.
And then men stop making progesterone right around the age of 50. It stops.
Mm-hmm.
And and the thing about progesterone, even though it's thought of as an anti-estrogen hormone, and it is, but progesterone also blocks adrenaline and it also blocks insulin.
Mm-hmm.
And and if you think about it, men after the age of 50, they start putting on weight around the middle.
Yeah.
And part of the reason is they no longer have progesterone to block insulin. And men start getting prostate cancer, which is also caused by estrogen. But again, they no longer have progesterone to protect them from estrogen.
Yeah.
So it's an important hormone for men, women, and also, believe it or not, for babies. We could, just to mention, you know, I talk about adrenaline, and the book I wrote is Adrenal Dominance, but the first evidence of adrenal dominance is found in babies that have colic, because colic is caused by excess adrenaline, and, you know, all you need to do is take a 5% progesterone cream and rub it on the baby's belly. It goes away in about 3 minutes.
Wow.
So mothers don't have to stay up all night with a crying baby.
That's crazy. So when it comes to progesterone, like, because progesterone and estrogen, as you said, they're both hormones that work within the body. Is there, if estrogen is up, is progesterone down? Is that the way it works? Is it like a seesaw effect, or not quite?
No, progesterone, it doesn't lower estrogen levels. What it does, it blocks estrogen receptor sites.
Okay.
Which is important.
Yes.
If you want.
And when it comes to men, like obviously you're saying it is very important for them to have it. Is there such thing as too much progesterone that you can have as a male compared to a female?
You know, I've been using progesterone now for about 20, 30 years or so, in patients and myself, and there's no downside to it.
Mm-hmm.
I've never heard of anybody overdosing on progesterone.
Yeah.
There's a certain situation when people won't be able to tolerate progesterone, but that could be any strength.
How would that look if they couldn't tolerate it? Because your products are topical, right? So how would it look if they couldn't tolerate?
Well, are you familiar with something called type 3 diabetes? By
Yes,
chance?
definitely. Okay.
And for your listeners, type 3 diabetes is the other name for it is insulin resistance in the brain.
Yeah.
And why it's important? It's one of the major precursors to Alzheimer's disease. Mm-hmm. And in this situation, what happens is that the insulin in the brain has a real hard time getting glucose into the brain cells. And glucose is one of the two fuels that the brain uses. And so it's a situation that predisposes to Alzheimer's. So when people already have this condition and then they use progesterone, one of the benefits of progesterone is that it does create some degree of insulin resistance. And why this is a good thing is because it prevents people from getting sleepy in the afternoon when insulin peaks, and prevents people from getting sleepy when they're driving. Mm-hmm. But if people already have insulin resistance and they use progesterone, it increases the insulin resistance. and the brain has an even harder time getting glucose into the brain cells. And the way this works is that the body responds to a lack of glucose in the brain by putting out adrenaline. Mm-hmm. So what happens is right after people use progesterone, their adrenaline increases when they have insulin resistance in the brain. And this is sort of a dramatic increase. People get more tense, they get palpitations, they get anxious, muscle tension right away. And the good part of this whole thing, they don't have a test for insulin resistance in the brain. This is actually a test for it. It's not known to the medical community, but it is a test for insulin resistance.
There you go. And so we actually did a podcast on insulin resistance and insulin sensitivity last week. And realistically, a lot of it comes down to diet and lifestyle. So are these factors that come into play as well when we're trying to make someone insulin sensitive, when we're trying to make sure that they're not having these crazy crashes from the insulin? Is this something that you put into play as well? Like, we're looking at diet, lifestyle, and progesterone just helps to get you there faster?
Well, yes, but let me clarify something. When I talk about insulin resistance in the brain, this is different from what they call insulin resistance with regard to type 2 diabetes. But in either case, eating obviously is an important
big factor.
Big factor.
So it is kind of just like a fast track.
I'm sorry?
Sorry to interrupt. I was just going to say it is kind of just like a fast track by using progesterone.
Right. Yes. Progesterone is certainly my favorite hormone, and and it has many benefits. And we'll be talking about some of them, but also this whole thing about insulin resistance in the brain, it's actually treatable. And because the whole thing about Alzheimer's is really a disease of prevention.
Yeah.
And so if somebody knows that they have insulin resistance in the brain, there are ways of getting around this problem. And the primary way of getting around it is to provide the brain with the other fuel that it uses, which are ketones.
Yeah. Yeah, and there's lots of studies coming out about this, right? Like, there's so much studies going into people who are showing early signs of Alzheimer's, or people who even have Alzheimer's. They change their diet around and they thrive. They go really well. They start to get their memory back, and they're not in the state of not remembering who they are or who their family are, or they can start to remember bits and pieces of their life, which is it's crazy, but it's not that crazy really, because like you said, you've got two sources of fuel, glucose or ketones, so why not use the other one if one's getting blocked?
Right.
Yeah, it makes a lot of sense to me, but unfortunately there's a lot of people who aren't willing to change. Like, they get to the stages of being too far gone, and either the carers that they have or the state that they're in, just, I don't know, for some reason they don't ever look into changing diet, even though diet and lifestyle is probably the biggest factor for most causes, even hormone imbalances and things that we're going to be talking about today. I would say, like, it's typically because of what we're eating day in, day out that sends our hormones into a negative response, or the things that we're doing day in, day out that are creating high levels of stress, and that then throws the imbalance of the hormones. Is that kind of spot on? Is that something you'd agree with?
I would agree with it 100%.
Yeah, okay, great. I thought that was the case, or that's everything that we stick by and everything that we do, but it's good to hear it from yourself, from everything that you've gone into. So when it comes to the bioidentical hormones book, is the progesterone kind of the major factor that you dived into there? What is like the big overhaul of that book when it comes to, I guess, because really we're talking about a lot of men and women within the world that now have imbalances in their body, so it stops them from losing weight, it stops them, or it might create things like anger and mood swings. It might mean that they stop sleeping well, it might mean that they get skin irritation or hair irritation, or they can't put on muscle, or they're dropping too much muscle. Like, there's so much that's encompassed in this area of hormone imbalances. So is this kind of what this book dives into?
The book talks about a number of different conditions, mm-hmm. and how they're influenced by different hormones. Even in the first book, I talk about ADHD in an 8-year-old.
Yeah.
and how he actually eliminated in 24 hours. It was gone.
Wow.
And and yet, at least here in the United States, they have literally millions of children on drugs for this
Yeah.
condition.
Yeah.
And which is interesting because one of the side effects of this drug are sudden death. But that never stopped the FDA from approving drugs.
Oh my God. That's insane. That's absolutely insane. I mean, realistically, a lot of these drugs that they're selling are focused drugs to make them think of one stream rather than multiple things. And really, attention deficit disorder it's the fact that they're not interested in the things that they're watching or that they're trying to, like, being forced to watch or learn. So you sit a kid down in front of a teacher and he doesn't find any interest in the teacher or what the teacher is saying, and that is where they then say, well, you've got ADHD because you're not paying attention to me. How did you spin around a person within 24 hours? What did we look into? Like, how did you change that?
Well, first of all, what you're saying is absolutely correct. ADHD is not a learning disorder. It is an interest disorder. Mm-hmm. And, in my book, Adrenal and Dominance, which I talk a lot about ADHD, and there I put conditions into different categories, the good, the bad, and the ugly. Yeah. The only condition I put in the good category is ADHD. And the reason for that is that the most intelligent, successful, creative people in the world have ADHD. Yeah. So how bad can it be? Yeah. And again, let me repeat what you said. It's not a learning disorder. It's an interest disorder. Yeah. But ADHD is all about excess adrenaline, mm-hmm. and adrenaline is a hormone. It's also a neurotransmitter. And as a neurotransmitter, it makes the mind go very quickly. So this is why if they're not interested, they get distracted very easily because the mind is going very quickly. Okay. So just by lowering adrenaline levels, within 24 hours, all of a sudden, they can focus on everything. And remember, adrenaline also gives these children intelligence. So they could go from failing out of class to becoming number one the number one student in the class. Because they're all intelligent, they just have trouble focusing. And remember, children with ADHD grow up to be adults with ADHD. Exactly. It doesn't go away. Yeah. And it also always runs in families. If you have a child that has ADHD, then he got it from one or both parents. Yeah. And now, they talk about ADHD, and by this, these are the kids that have trouble focusing, they're hyperactive. And then you have another type of ADHD, what they call ADD. Yeah. And these are kids that have trouble focusing, but they're not hyperactive. Mm-hmm. And these are the children that I call creative type ADHDs. Yeah. And creative type ADHD people actually have even more adrenaline than typical type ADHDs. And remember, the body is putting out adrenaline simply to raise sugar levels for the brain. Yeah. And the whole thing about sugar, it doesn't matter whether people are eating sugar or if the body's making sugar. If you don't burn it up, all that extra sugar gets stored in your fat cells as fat. And so children with ADD always have a weight issue. Because adrenaline peaks around 2:30 in the morning, so they're putting out a lot of adrenaline while they're sleeping or trying to sleep, and that's when the body's creating fat. And this goes on into adulthood, where you have creative type people that are very prone to gaining weight, and it all happens while they're sleeping. And
that's very interesting. I never put that connection together of the ADD and overweight issues. When it comes to decreasing adrenaline, because really your body doesn't know the difference between adrenaline from, say, you're playing sport compared to adrenaline because you're in danger and you're being chased by a dingo or a grizzly bear for something for the Americans. And so realistically, when it comes to that, how do we reduce adrenaline? Like, knowing that there's adrenaline in the body and too much adrenaline, no matter what the state is or what it's coming from, how do we go about reducing adrenaline in a natural way?
Well, it all comes down to treating the cause of a problem. Mm-hmm. And so when it comes to excess adrenaline, what relatively makes it simple is that there are only two reasons why the body puts out adrenaline. One, if you're in danger. Yeah. but that's a rare reason why the body puts out adrenaline,
Yes.
unless you live in a war zone. The primary function of adrenaline is just to make sure the brain has fuel. And most people don't realize that the brain uses more sugar, more glucose than any other part of the body for weight. And anytime you take glucose or sugar away from the brain, you get sleepy. You know, they call that hypoglycemia. So the so the primary function of adrenaline is just to make sure the brain has fuel. So what that means is that if people provide fuel to the brain, the body doesn't have to use adrenaline to do it.
Okay. So yeah, go for it. Yeah.
Yeah. So again, going back to what we were talking about before, that the brain uses two different fuels. You know, one is glucose, and the other are ketones. So the best source of glucose for the brain comes from vegetables. It's not the only source.
No.
But the reason why vegetables are a good source is because they don't produce a lot of insulin. In other words, they're low glycemic. Candy and soda are great sources of glucose, but they produce a lot of insulin.
Yeah.
And then the insulin defeats the purpose because it lowers the sugar. So green vegetables are zero glycemic. They don't produce any insulin at all. But in any event, vegetables are a better source of glucose for the brain. And then in terms of ketones, you know, people know about a ketogenic diet, which I don't recommend because it's too tough a diet.
Yeah.
You know, people have the discipline, they can do it. But there's something called MCT oil and something called coconut oil.
Yeah.
And these are the two sources of ketones. So you don't have to be on a ketogenic diet to get to get ketones. And once you're providing the right fuel to the brain, basically within 24 hours, there's a significant drop in adrenaline. It's not a long-term treatment program, which is good.
That's really interesting. So something that something that we really focus on with our base or our phase 1, phase 2 people that come into us, so going through our system, is that we put them onto a diet that has protein, carbs, and fats at every meal and snack, so every time they're eating. And the whole point around that is to make sure that we're not getting the extreme spikes of insulin and the extreme crashes, or sugar spikes and sugar crashes, as well as the extreme lift in insulin. Now, within saying that, we actually find that people get more energy across the day once they've gone through the first stages of becoming from being a sugar burner to being a fat burner. But you're saying that essentially they've got less adrenaline in the body, but they're just utilizing the fuel that they have. Is that correct?
Well, if they're not using adrenaline to create fuel, then they have no other choice but to use the fuel.
Fats. Yeah. And so that's why people then start to really burn off the fat, because obviously they're utilizing fats of their own body cells instead, because it's no longer looking for glucose, no longer needing to go through gluconeogenesis or anything like that if they don't have sugars in the body.
Exactly.
Yeah.
But you know, a lot of people have trouble sleeping at night, and the number one reason why people have trouble sleeping is because the body's putting out adrenaline.
Yeah.
You know, not only does this cause insomnia, but it causes the mind to race sometimes, and it makes people grind their teeth at night or clench their jaw. It causes what they call restless leg syndrome and tossing and turning, and the need or the urge to get up and urinate throughout the night. It's all adrenaline.
Yeah, wow. And so, I mean, there's a lot of things that we can do around sleep, like pre and post sleep, but essentially if people understand what their diet is doing to them, that can be a bigger state to help them sleep. Like you saying, before bed, everyone should be having some MCT oil or some coconut oil to make them sleep better?
Well, either that or some leftover vegetables, you know, from dinner. Now, not all people need to do this, but people that have trouble staying asleep are the people that need to provide fuel. Yes.
Okay, and say for instance there's someone who's having dinner later instead, like they eat dinner at 8 o'clock, they're in bed by 10 o'clock. Is that someone who should still be trying to eat just before bed?
Well, you know, everybody's a little bit different.
Yeah, exactly. N equals 1.
Right, and a lot of it has to do with you know, there are a lot of people that exercise during the day. And people have to realize that when they're exercising, the muscles are burning glucose, which is the same fuel the brain needs.
Yeah.
So if they're sort of depleting the brain of fuel, then there's a good chance they're going to wake up during the night.
Yeah. Yeah, wow.
So,
And what about if you were to be on a diet that's full enough in foods? Like if you're eating correct amounts, will you still wake up even if you're training, essentially? Like can you have a good restful sleep?
Well, again, I mentioned exercise, but people that use their brain a lot, also, that's why, creative people, their brain uses up fuel in about 3 hours because their brain is a lot more active. So, and when people are driving and they get sleepy when they're driving, again, when they're in a car and they're looking out the window, their brain is registering all that scenery that's going by.
Yeah.
And they think, and looking at other drivers, maybe listening to the radio, talking, and, the brain uses up a tremendous amount of fuel when somebody's just sitting in a car.
Mm-hmm.
So,
yeah, that's really, really interesting to me. And so, vegetables or some extra MCT oils or some coconut oil, by adding that into the diet, we're essentially saying that that's going to help them with getting more ketones to the brain, but obviously they can't be having too much carbohydrates within a day because then their body's not going to produce ketones as well. Is that correct in saying that? Although if you're using MCT oils or coconut oil, that is essentially going to help with ketone production.
well, it'll certainly help with ketone production, not so much with glucose production.
Yeah.
But the primary reason the body's putting out excess adrenaline is for glucose, not for ketones.
Mm-hmm.
So eating, as you mentioned, has tremendous impact on people's health in general.
Yeah. And so when you have someone come into you that has ADHD, for instance, and I'm guessing a lot of cases are coming to you since you've written the book, The Adrenaline Dominance, because like you said, that's a lot of stuff you talk about in Adrenaline Dominance. When people are coming to you with ADHD, what's the sort of protocol look like for them? What are the changes you're making straight away versus some things that we work on long term instead?
Well, anybody, there are a lot of different problems related to excess adrenaline. ADHD is one of them, but basically the approach is the same for any kind of problem.
Okay.
And it's a combination of two things.
Yeah.
One, they're taught about the importance of adding the right fuel for the brain.
Mm-hmm.
And the other thing, which is almost as important, not as important, but almost as important, is the use of progesterone cream.
Mm-hmm.
And, usually if somebody comes in to see me and, I keep some progesterone cream on my desk.
Yeah.
And, I apply it on their arms. And usually the first thing that'll happen is that they feel a lot more relaxed because it directly blocks adrenaline. And then very shortly thereafter, they're able to focus better because their mind is not racing like it was.
Yeah.
But people that are sitting down, their knee is going up and down like this, that's adrenaline.
Mm-hmm.
I had a fellow that came in to see me. He was in his mid-40s. And the reason why he came in is that every morning of his life he would wake up and vomit. And basically the only thing that'll cause that is excess adrenaline. And needless to say, he also had severe fibromyalgia. And fibromyalgia is also caused by excess adrenaline. And anyway, I put some cream on his arm and he's sitting in his chair. And then after about 4 or 5 minutes, he sat back in his chair and he looked at me and he said, "Doc, in my entire life, I've never felt this good."
Wow.
And he has not had one episode of vomiting since he came into my office. One of the nice things about treating the cause of illness is that people improve right away. And unfortunately, because doctors don't do this, they don't get this kind of impact.
No.
And it's a shame. It's because it's very rewarding to get somebody better again.
So once they've started on progesterone cream, though, are they then reliant on that for life now? Or is that something that they have to keep in?
Well, unfortunately, excess adrenaline is a lifelong.
I
Uh,
thought that would be the case. Yeah.
yeah, it's not going to go away.
So let's talk about like right now we've got an epidemic of people who are stressed and anxious and this even depressed. Like this thing is growing huge within the world. Would you say that that is once again because of over adrenaline, like too much adrenaline within the body? So now if they were able to use some form of progesterone cream or something like that instead, that would then help with their situations.
Well, the thing about adrenaline, it's like the number one cause of stress,
Mm-hmm.
and and but again, and then there's anxiety, and again, adrenaline is probably the only cause of anxiety.
Mm-hmm.
And when it comes to depression, one of the most common causes of depression is from internalization of anger. They call that an endogenous depression.
Yeah.
The other type of depression is a reactive depression. So somebody in the family dies, or a pet dies, or somebody loses a job. That's a reactive depression. Not a whole lot you can do for that, except a tincture of time.
Yeah.
But internalization of anger, the number one cause of anger is adrenaline. Road rage is pure adrenaline, and that goes away in 24 hours. I mean, that's how quickly people can improve just by lowering adrenaline. And unfortunately, it's basically unknown to the medical community, and it shouldn't be. But unfortunately, again, if I can get on my little soapbox here, the trouble with the whole business of medicine is that it's controlled by drug companies,
Mm-hmm.
and drug companies control the FDA, they control the medical boards, they control what doctors learn in medical school. So the entity that controls medicine has no interest in people being healthy.
No, it closes them down.
Yeah. Not
Yeah.
a perfect one.
No, it's not perfect at all, unfortunately. And like you said, like it is awesome to see that. Obviously, a lot of the stuff that you're saying is all anecdotal, and you're seeing this day in day out within your space and your clinic. But when it comes to something like the progesterone cream, is your progesterone cream the only cream that you know of in the world that would work, or can someone just take a progesterone supplement? Is there things that people can use outside of the one that you've created that would work?
Excellent question. When it comes to progesterone creams, there's probably over 100 different creams on the market.
Mm-hmm.
But when it comes to blocking adrenaline and insulin and estrogen, the ideal strength is 5%. That's the exact strength you need to block adrenaline.
Okay.
And so our cream is a 5% cream. There are certain creams, we were not limited. We could have had any strength we wanted. But there's no advantage to having like a 10% cream, except it's more expensive, but it doesn't provide any more benefit. The creams but most creams on the market are 2% or less. And unfortunately, that does not block adrenaline. It can sometimes even act like estrogen. It goes to estrogen receptor sites.
Okay.
So the lower strength I don't recommend. They also have an oral progesterone.
Mm-hmm.
One of the brand names called Prometrium. And the problem with the oral progesterones is that they go straight to the liver. They convert into a different hormone called allopregnanolone, and which is not a good type of hormone to have. It can even increase the chances of breast cancer. So but it doesn't give people the protection that they need from estrogen or adrenaline. So yeah. Now the thing about Australia is not big on progesterone supplements. They try to block them as best they can. We do ship to Australia. We send it as a body cream, not as a hormone cream.
Yeah.
But so there are ways of getting it, but there are so many benefits to progesterone just because it blocks the three most toxic hormones in the body. I mentioned fibromyalgia. In the United States, there are 10 million people that have fibromyalgia. And again, it's a pain condition.
Yeah.
And the other thing people complain about is fatigue. And the reason for the fatigue is that these people have so much adrenaline that they keep their muscle tense. You know, it's a fight or flight hormone. And just keeping muscle tense uses up a tremendous amount of energy. And then the pain is due to a buildup of lactic acid in the muscle tissue. And so 10 million people with fibromyalgia, and they're all told the same thing, that there's no cure for it. But doctors say that about a lot of conditions, unfortunately. But I tell people that do have fibromyalgia, they're going to have chronic pain. It's the best thing they can have because it's the easiest chronic pain condition to get rid of.
Yeah.
You know, just by lowering adrenaline. So.
It's so crazy. And is there natural ways that we can increase progesterone? Like you said earlier in the conversation, that men, once we hit 50, we start producing it ourselves. But for the younger generation and for women, is there something that they can do individually to start to produce their own progesterone or make it higher?
You know, unfortunately, I have to answer no. The progesterone comes from two different sources. It comes from soy or yam extract.
Yeah.
But the problem is that we can't convert soy or yam into progesterone. It has to be done in the manufacturing facility.
Yeah.
Even though they have yam creams, and that's fine, but it won't produce progesterone.
No. And when it comes to, I mean, realistically, the world we live in, unfortunately, is just full of estrogen, and it's going to only be worse and worse for us because, like, there's the plastics, obviously, but then there's all the different sprays and things that we're using on crops now. There's within a lot of our body care products, so cleaning products for the house, but also your products for the skin and for hair, like bits and pieces of everything really has some form of estrogenic in it, which is something that a compound that will react as estrogen within the body or produce more estrogen within the body, which is kind of crazy because realistically the whole world has shifted towards that. So would it be fair to say that everyone should be on progesterone of some sort?
I think yes. I think it is fair to say that. You know, around the turn of the last century, around early 1900s, the incidence of breast cancer was like 1 in every 94 women.
Yeah.
Now it's 1 in 8, and it's absolutely due to this being exposed to so much estrogen. To me, estrogen is a very toxic hormone.
Yeah.
You know, what's interesting, they use it to fatten cattle and chickens. And by law, it's illegal to put anything into an animal that's going to be sold for food consumption that causes cancer. How did they get away with this?
Yeah.
But they do. And
so how about? Right. I was going to say, how about like high people who eat foods high in estrogen, things like lots and lots of soy? Do you see like multiple issues come from that? Like people are then coming to see you because of like they've just got too much estrogen due to diet?
Usually, people that I've seen that have problems related to excess estrogen, it's not so much their diet, it's really because their body produces too much estrogen, or these are women that have been put on birth control pills, and why they allow birth control pills to be sold, I don't know.
No.
But, you know, they prevent women from ovulating, which means it's another way of saying it prevents them from making progesterone.
Yeah.
And then so they become what's called estrogen dominant, and that's where, you know, fibroids and endometriosis and fibrocystic disease of the breast and polycystic ovaries and you know, and estrogen causes gallbladder disease and asthma and migraine headaches and lupus and rheumatoid arthritis and 6 different cancers and phlebitis and blood to me, it's a very toxic hormone. And so women in the menopause who are no longer making a lot of estrogen, it's very rare that I treat it because, again, I look at it as a toxic hormone. The only estrogen that I ever recommend is estriol, which is one of the 3 natural estrogens, but it's the only one that doesn't cause cancer.
Yeah.
And it's the only one that's effective for vaginal dryness. So that I don't have a problem with. But I'm not a big estrogen fan. But, you know, you have all these women now, they're getting estrogen pellets. I don't know if they do that in Australia.
I don't think so. No, not that I've heard of.
Well, well, that's good. But yeah, so well, here in the United States, there are a lot of doctors that do pellets because it's very lucrative for them to do that. And then they put women on oral progesterone, which doesn't protect them. And then if they start bleeding from the uterus because of the pellets, then they do a hysterectomy, so they get the benefit of doing the surgery on the same women that put the pellets in. Anyway, I just okay, I'm not a big fan of estrogen.
Mm-hmm. No, that's great. I would agree. Now you said that you don't treat them if they're postmenopausal. Do you mean just with estrogen, or do you mean in general you won't see women that are postmenopausal?
Well, I see a lot of women that are postmenopausal, or have seen a lot of women, and basically, you know, the number one hormone that has to be replaced is progesterone.
Mm-hmm.
And then another really important hormone to replace in women is testosterone. You know, after a certain age, the number one cause of death in women are heart attacks.
Yeah.
And what people don't realize is that the heart has more testosterone receptor sites than any other part of the body.
Wow.
And
that's the first time I've ever heard that.
This is why women actually have more heart attacks than men do, I believe. So testosterone, I think, is a good hormone to replace in women. Mm-hmm. And DHEA is also a good hormone to replace both men and women.
Yeah. And you're getting that naturally just from fish oils and things like that, or are you?
No, that's DHA.
Sorry, what?
DHEA. Oh,
what did you say?
Yeah, it's dehydroepiandrosterone. At one time, DHEA is actually the most abundant hormone in the body.
Yeah, got you.
But as people get older, that level goes down, and they look at it as a biological marker for aging. But people with the highest levels of DHEA actually have the greatest longevity. So you can probably look at it as an anti-aging hormone.
Yeah, wow, okay. How about things that they've been using for anti-aging, things like metformin and stuff like that? Is that just another drug that's going to create a lot of issues within individuals?
Well, I'm not a big metformin fan.
Yeah.
There's a supplement that people get in a health food store called berberine.
Yes.
And berberine does everything that metformin does, except it doesn't have the side effects that metformin does. And it's probably more effective. So if somebody has diabetes, it's probably the drug of choice for diabetic. Mm-hmm. It's berberine. Metformin is getting some bad publicity now because now they're finding some cancer issues related to it.
Yes, I did hear that. How about, I'm going to butcher the name, nicotine riboside, maybe? I think it might be, is another one that they're using for anti-aging. I've gone and butchered that, sorry.
Well, if they are, they could, they have a number of things. You know, a lot of people talk about telomeres when it comes to
aging. And
what's interesting, stress is probably the number one thing that actually shortens telomeres.
Yes.
Which is another way of saying adrenaline. So, again, another advantage of lowering adrenaline is it might prove to be the very key factor in terms of longevity.
Yeah.
Is to prevent stress and shortening of telomeres.
So, obviously, what you're doing is creating a straight response within the body, but there's obviously a lot of things that we have within our lifestyle that create stress. Are you then diving into, with the patients, okay, so we've worked on it from a cellular level, now we need to work on it from an external factor level and make sure that you're not getting high amounts of stress coming from your lifestyle. Like, if you've got an incredibly stressful job, if you've got incredibly stressful friends or family, or you're in a toxic relationship, or whatever it might be, are these all things that you're then starting to address because it can start to unwind what you've done?
Well, if people are under that kind of stress or concern, it never hurts to lower their adrenal. Mm-hmm. Adrenal is not a happy hormone.
No.
And like I say, just by adding some vegetables and some coconut oil into the meal plan and using some progesterone cream, it's an easy, natural, healthy way of dealing with a lot of concerns. You know, you might want to ask, how does somebody know if they do have increased adrenaline?
Yeah.
Yeah, other than trouble sleeping, other, people that carry a lot of tension in the back of the neck, that's always adrenaline. And very often this can lead to what's called tinnitus, ringing in the ears, because the muscles actually cut off the circulation to the inner ears. Some people get headaches, and people very often feel that they might have what are called migraine headaches.
Yep.
And what's interesting, I would say that 98% of people that think they have migraine headaches actually have a different type of headache. And it's called occipital neuritis. It comes from the occipital nerve sheath at the base of the skull. And they can tell whether or not they have a problem there, because if they press in with their thumb, they'll find a very tender spot at the base of the skull. And it causes excruciating headaches, just like migraine headaches.
Yeah.
And very often they shoot right into the back of the eye, and it causes a visual field defect. Anyway, these are really easy headaches to get rid of because they're all caused by adrenaline. And you can just take some progesterone cream and put it on the back of the neck, they're gone. You can get rid of ringing in the ears the same way by putting progesterone cream on the back of the neck. People that have cold hands and cold feet, it's always blamed on a low thyroid, but actually it's not thyroid, it's adrenaline, because adrenaline cuts off blood supply to the hands and feet, just like it cuts off blood supply to the intestines, because adrenaline is a survival hormone. It cuts off blood supply to areas of the body not needed for survival. So the intestines are not needed for survival, and that's where what they call irritable bowel syndrome, IBS, comes from. And then it also cuts off blood supply to the salivary glands. People with chronic anxiety very often always complain about a dry mouth, but also people have to remember that if people have excess adrenaline, they can't do saliva tests because the hormones don't get into the saliva. That's where they came up with the diagnosis of adrenal fatigue. It's a condition that doesn't exist, but it's based entirely on finding low cortisol levels in the saliva. If they did a blood test, they would find the cortisol levels are high. The problem here is that it's a naturopath diagnosis, because they're the ones that do saliva tests, and very often they'll start somebody on something like Cortef, which is cortisol, when they already have high cortisol levels, and again, cortisol is not a happy hormone. It creates fat and osteoporosis and brain damage. But anyway, and then, there are a lot of other conditions related to excess adrenaline. You have PTSD, you have bipolar disorders, there's another condition called PMDD, which you've probably never heard of. It's premenstrual dysphoric disorder. It's found in about 8% of women. And these are the women that for 10 days out of the month, nobody can live with them because they have severe anger issues and severe mood changes. Yeah. And it's a condition felt to be incurable. They don't know the cause of it, but it is caused by excess adrenaline. Very easy to fix. Everything is easy to fix if you treat the cause. Yeah. They have a thing they advertise on television called an overactive bladder. And, adrenaline get people that urge to urinate. So when people have a lot of adrenaline, very often they have to run to the bathroom. Some women lose urine when they're running to the toilet, and they call that urgency incontinence. But again, it's caused by adrenaline, and you can get rid of that in 24 hours. But instead, a lot of women are now getting Botox injections in the bladder, which means that for the next 3 months, they have to catheterize themselves every time they have to urinate. Oh, yeah. There's another condition called chronic interstitial cystitis that causes severe burning and pain in the bladder. Again, felt to be incurable, but it's also caused by excess adrenaline. I'm just saying, it's like this whole thing about excess adrenaline, it's way underneath the radar. Yeah. And it's so easy to fix. And it's nice when I get a chance to chat like this, because it gives me a chance to
help lots of people
get the message out there.
Yeah, I mean, just that conversation alone, there were so many little aha moments. Like the people who always ask, well, I wake up at the same time every night. What is that? Why is that? If I need to go to the toilet at 2 p.m. every single night, no matter what happens, I'm always up at 2 p.m. It makes so much sense now that you're saying, well, that's when the adrenaline is so high, and that's when their body's producing the most, and that's why they go to the toilet at that time every single night, because the body's clockwork just works how it's meant to. The other thing that was quite interesting to me was the IBS statement around how it can help heal the gut. So when we're looking into that, like a lot of autoimmune issues are coming because of gut issues, essentially, like where we stop being able to take in any nutrients at all. Does that mean that a lot of people who have autoimmune issues should look into progesterone as well to help reduce the amount of adrenaline?
Well, when it comes to autoimmune issues, there's probably something better than progesterone. It's called low-dose naltrexone. Are you familiar with that?
No.
They also refer to it as LDN, but it stands for low-dose naltrexone. It's good for any kind of autoimmune disorder, especially things like MS, and they use it for Hashimoto's and whatever. But progesterone is not necessarily, is good would be good for lupus and rheumatoid arthritis, which are also autoimmune type condition. But what it all comes down to is that as much as possible, people should try to treat the cause of whatever problem they have.
Yeah.
And so anyway, but medicine has always been a passion for me, and getting people well, it's very rewarding. It really is.
Yeah, definitely. When you can change someone's life around in a matter of, like what you're doing, in a matter of 24 hours, that's huge. We see it within a week, 2 weeks, 3 weeks, 4 weeks, and when people are willing to put in the effort, you change their life around within a month, and they are so thankful. It's just amazing. It really is. It's kind of what gets me up and makes me do the things I do each day.
I wanted to just sort of come back to that thing about adrenaline coming out at night around 2:30 in the morning.
Yeah.
And people have to realize that the reason why the body is releasing adrenaline is just to raise sugar levels. But when the body puts out adrenaline, it creates stress to the body. And then in response to that, the body puts out cortisol to deal with the stress. And the first thing cortisol does, it also raises sugar levels. And so here, while people are sleeping or trying to sleep, they're putting out two hormones that raise sugar levels. And I am pretty well convinced that it's probably the number one cause of weight gain, at least in my country, in the U.S., but possibly also Australia. It's just not thought about. That people can actually put on fat while they're sleeping, but that's what happens.
Yeah, because a lot of stuff that we talk about is we're trying to reduce cortisol, we're trying to reduce inflammation within the body, and that's a lot of stuff that we're helping individuals with, and we always see a decrease in body fat from doing that. Sorry.
Yeah, that's it. It's that a lot of people have always talked about cortisol and creating fat, whatever, but what they don't think about is the reason why the cortisol is being released is because of adrenal.
Yes.
So in order to get cortisol to go down, you really have to get adrenaline to go down.
And so, I mean, like I said from the start, a lot of the stuff that we're working on is always diet and lifestyle. And we always see some results. But if someone was, for instance, really focusing on their diet and lifestyle and they weren't seeing results, something like progesterone would be a good starting point then, because it's going to obviously help to re-hormone balance themselves.
I would agree with that.
Yeah, okay. It makes a lot of sense. Like, I've never really heard it put out in this way, and it makes a lot of sense to what you're saying. And it's a very interesting topic. Like, straight away, it's just like, oh, well, you've found the cause, which is really great. And to, like you said, to shift people's life around within 24 hours is massive. Aside from self-assessment, when it comes to I'm having these issues, are you doing any other tests before you go and put someone on progesterone?
In general, I have to be honest with you, I always prefer treating people rather than lab tests. I look at lab tests, but I treat people. But if somebody was to say, what's the number one test that I could have done to indicate that I'm putting out too much adrenaline, it would be what's called a morning cortisol test, done before 9 a.m. And again, the reason for that is that, remember, adrenaline peaks at night, and it creates stress, and the body responds to stress by putting out cortisol. So, but let me repeat: make sure it's a blood test, not a urine test or a saliva test, but a blood test for cortisol. And a normal level, the normal range goes, depending on the lab, goes either up to 19.4 or 23.2. But the point is the number should never be over 14. The reason why the levels are that the range goes up that high because they use medical students to determine normal cortisol levels, and all doctors have increased adrenal.
That's ridiculous. And so, if you're normal, you're actually not in a healthy state when you go to the doctor, right? Because they will come and say you're in normal range, so you're fine. Whereas you would say, hey, I disagree. You need to be below 14.
Yes, and this whole thing about ranges when it comes to lab tests, a perfect example is thyroid. People don't realize there's a huge range when it comes to what a normal thyroid level is.
Yeah.
And there's a big difference between somebody being at the lower range and somebody being at the higher range.
Mm-hmm.
So that's why you can never go wrong treating a person, but you can go awfully wrong treating a lab test.
Yeah. It's the same for testosterone, right? Like, we'll have men go in and get their testosterone tested, and they're normal, although they're right at the bottom end of it. It's like, oh no, it's a little low, but you're fine. And realistically, they're crashing and burning every day.
You're absolutely right. Yes.
Yeah, mate, that is so interesting. Thank you so much for your time today, Dr. Michael. It's been absolutely incredible. I'm very interested to kind of dive in a little bit more and actually read over the books, and even get some progesterone cream over and trial it out and see how it goes. And straight away when we were talking, there's a lot of people that I think about within our community that have been doing things really well, but not seeing a difference, and they've got stressful lives, and we're trying to work on reducing stress. Like, we're looking into lifestyle, we're looking into nutrition. They're really nailing a lot of the things, but this could just be the answer that would really kind of be the turning point for them and really help them out. So I'm definitely interested to try help them out with this and see how they go.
Okay, if they have any questions, they can always get in touch with me at my website is platwellness.com.
Yeah.
And do they have Amazon in Australia?
We do. I don't know how it works as we definitely do have an Australian branch, but I don't know how that works for all of the products that you sell within America. I don't know if the American products can be just shipped straight across or not, but we definitely do have Amazon, and we definitely do have access to the American one as well.
Okay.
Is that the best place to get the cream?
Well, the best way is through my website.
Uh-huh.
Like I say, we do ship to Australia. Anyway, and if they have any questions, though, they can always get in touch with me.
Yeah, definitely. So platwellness.com is that one, which is PLATT wellness.com. But I will link that in the show notes, as well as some links to some, like the cream, as well as links to your books as well. So is there anything else that I should have asked Dr. Michael Platt before we finish up?
What an interesting question. Well, I don't know if addiction is a big problem in Australia, but again, the number one reason why people get involved in drugs and alcohol is just to relax, just to chill out.
Yeah.
So what I'm actually saying is that excess adrenaline is probably the number one cause of addiction. You could look at the music industry and the amount of drugs and alcohol in the music industry, but these are very creative type people, and as I mentioned, creative people have the most adrenaline.
Yeah.
And if I have time, can I describe what a creative person is? So
please do. Yeah.
Creative people, when people have a lot of adrenaline,
mm-hmm.
and they have a right brain, which is a creative type brain, the adrenaline in the right brain allows them to tap into the energy that goes through the air. A lot of energy going through the air. So people that are creative are very intuitive about other people. They can pick up good energy and bad energy from people. They often have premonitions and deja vu type feelings. When the phone rings, they'll answer it and say, "I was just thinking about you."
Mm-hmm.
You'll also find that animals and small children will be very attracted to them.
Mm-hmm.
And this is how, and they have the same ability as clairvoyants and psychics. This is how clairvoyants and psychics work. And dog whisperers and horse whisperers also have the same ability, and they have the same ability. So it's very interesting to me how adrenaline can affect, I guess, the way people are, if you will. So, but creative people have the most adrenaline. And
so with a creative person, for instance, if you take away the adrenaline, does it take away anything from the person? Or does it make them thrive?
No, it actually they can actually
Concentrate.
focus
Yeah.
better
Yeah.
because the mind is not being scattered. Yeah.
It's so funny. Literally so much of what we've talked about today has been very relative to myself. I was in bands growing up. I've always been very creative, very intuitive with people. But one of the biggest things that stuck out straight away as soon as we started talking was about being tired at the wheel. And a lot of our listeners already know this, but I was in a pretty big car crash last year where I rode off the car because I fell asleep at the wheel. It was like a blackout. It just went. I was so close to home, but realistically, a lot of this is all very relative. Like even talking about the person who sits and bounces their knee or always needs to be doing something like. I'm a CrossFit person through and through where I go in and I thrash myself for a bit and then I come home and I try to focus all day in front of the computer. It's just, it's all very, very relative, very interesting to me.
Well, you have what I call a mixed type ADHD. You're typical plus creative.
Yeah.
And those are the most successful people in the world. The heads of every major corporation have two different types of ADHD. And not one of them ever finished college, by the way. And that they're heads of corporations. I just want to let you know. So you have that ability to be successful at whatever you're going to be doing. So
thank you. No, that's good to know. That's it's always just trying to find the control to focus, like you're saying, right? Like make sure you've got the focus on the things that you need to be focusing on. Make sure it's narrow-minded rather than multiple things happening at once.
You mind my asking if you have any kids, any children?
Yes, we've just had our first daughter.
Okay, well remember, any of your children are going to have a lot of adrenal.
Yeah, definitely will. It was so funny because as soon as you started talking about that, obviously it's been passed down from one parent to another. And I've always thought I was either dyslexic or had some form of ADD or ADHD, but I've never actually been tested for it to be clarified based on the test. But I don't think you really need it. But at the same time, as soon as you said that, I'm like, oh, poor Mads.
So, do you say you have a newborn now?
Yes, she's 4 months old.
Is doing a lot of crying at all?
No, she's a gem. Absolute godsend baby, yeah.
Okay. Yeah, progesterone is very safe to give women when they're pregnant. There's some women that vomit throughout their entire pregnancy.
Yeah.
And that's also caused by adrenaline, by the way.
Wow. There you go. We've been talking about this just yesterday because a lot of the stuff that Stace had issues with was zinc deficiencies. And we thought that was the cause of her sickness during pregnancy.
Well, if she vomited after the 3rd month, and you only see that in creative type women, by the way, because again they have the most adrenaline. So your child's going to have a lot of adrenaline, which is good.
Yeah,
you're very intelligent.
Yeah. There you go. No, I can already see that. Well, thank you so much. I'm really excited to share this with our community. I think there's so much in this, and realistically, it's so cool that you've just jumped straight to the cause. Like, there's no fluffing around. There's no going through this, and that. It's literally, let's test out this cream. Let's see how it goes for you. We can see response within 24 hours, which I think is just absolutely magical. So, thank you for what you do, and thank you for taking the time to be with us today.
It's been a pleasure, and thank you for having me.
Yes, so very, very welcome.